Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please go to my website, championshipchiropractic.com, where you can get additional information on the book, and you can also connect with me on other social media sites. Please enjoy this sports medicine video. Today's episode of Dr. Ozello's Sports Medicine Report is on the hip flexor strain. A strain is an injury to a muscle. The hip flexors are big, strong, powerful muscles located in the anterior or front aspect of the thigh. The front of the body is called the anterior part of the body in medical terminology. A hip flexor strain can cause pain not only in the hip, it can cause pain in the thigh, in the pelvis, and in the low back. Hip flexion is the motion where the front part of the thigh is raised towards the chest. So this is hip flexion. This is the concentric action of the hip flexor muscles. The principal hip flexor muscle is called the iliopsoas muscle. The iliopsoas is a combination of two muscles, the psoas major and the iliacus. The psoas major originates on the lumbar spine. It originates on the side of several vertebrae of the low back, and it goes inferior and it attaches to the inside aspect of the femur, which is the thigh bone, at a point called the lesser trochanter. The iliacus is the second muscle of the iliopsoas that begins on the front part of the pelvis, and it combines with the psoas major and also attaches into the lesser trochanter. So the iliopsoas is the principal hip flexor. Now there are other muscles that assist in this, but the iliopsoas is the primary hip flexor. The hip flexors are involved in every sport. The hip flexors are major muscles. They are extremely involved in activities such as walking. Every step we take, when we're walking, when we're running, when we jump, when we squat, when we kneel down, there's a great deal of hip flexion. So those hip flexors have to work very hard. The demand on the hip flexors increases if we are going uphill or up steps or downhill or down steps. So these muscles work extremely hard in all sports. They also have to work when we're sitting, when we're laying down. There is an extreme amount of tension being put on the hip flexors when we are laying down and when we are seated. So a hip flexor strain, the symptoms of this, it can be painful all day long. And just like any other muscle strain, there's pain, there is tightness, there is a limited amount of pain-free motion. So there can be pain, tightness, and limited motion in the hips, in the pelvis, and in the lumbar spine. This can occur when the patient is trying to stand, when the patient is going from a seated position to a standing position, and vice versa, when the patient is twisting. There is a lot of limited motion when someone has a hip flexor strain because these muscles are so large and they are involved in every motion. So the symptoms of a hip flexor strain, they can occur traumatically or non-traumatically. I'm going to go over that in a few minutes. But the symptoms, they can be long-lasting, where they can last all day long. Most muscle strains, they're going to be a little bit worse in the morning, get a little bit better as the day goes on. They're worse in the morning because we're not moving around at nighttime. So there's less blood flow going to the muscles, so they tighten up. And so they're worse in the morning once we start to move around. But they loosen up a little bit as the day goes on because there is blood flow going to those muscles. So they're not as tight, they're not as painful. But then as the day progresses, those muscles, because they're injured, they fatigue quicker. So they start to become more painful. So the pain with any type of muscle strain, a hip flexor strain included, is usually worse in the morning and then worse again later in the day. So we want to think about that when you have a hip flexor strain. Again, the symptoms are going to be pain, tightness, limited motion in the hip, in the pelvis, and in the low back area. These symptoms will be worse in the morning and later in the day. Those are a general rule for the symptoms. There can be pain in other areas. Also, one thing that you want to think about is compensation. If the hip flexors are not working properly, there can be pain in other areas because another area has to take a greater workload. So if the hip flexor is injured, there may be pain on the opposite side. There may be pain in the mid-back area. So it's all those things that you have to think about if you suffer a hip flexor strain. The hip flexor strain can have a mechanism of onset or mechanism of injury, however you want to say it. It can be traumatic or non-traumatic. I mentioned that just a minute or two ago. A traumatic hip flexor strain usually occurs when there's an overly forceful contraction, a concentric contraction of the hip flexor muscle. This can be when we're sprinting, jumping, kicking, a golf swing. It can be in a racket sport such as tennis, handball, anything where there is a lot of twisting and torque going on. And then also, well, I'd already mentioned the jumping. I was going to say when someone jumps, but I already mentioned that because there's a lot of force being put on the hip flexor muscles when we jump. So traumatic onset of a hip flexor strain usually occurs with an overly forceful concentric contraction of the hip flexor muscles. Now, the non-traumatic onset, this is an overuse injury. I've spoken a lot about overuse injuries in Dr. Ozello's sports medicine report when I've done my other classes. Any overuse injury is going to have three things that contribute to it. Overtraining, too much training, inadequate rest between training sessions, and some type of biomechanical fault. So those three things set the athlete up for injury. When we are speaking about a hip flexor strain, usually the intrinsic contributing factor or the biomechanical fault may be tightness in the hip flexors. It could be a strength imbalance where the hip flexors and the quadriceps overpower the hamstrings and the gluteal muscles. That is nicknamed quad dominance. There can also be weakness in the hip flexor muscles. So those three things usually contribute to a hip flexor strain, the non-traumatic hip flexor strain, where it is a strength imbalance where the hip flexors and the quadriceps are stronger than the hamstrings and the gluteal muscles. So the hip flexors will have to carry a greater load. Again, that's called quad dominance. What I had spoken about, also another factor, if the hip flexors are weak, obviously a weak muscle is a precursor for an injury. So that may be a source of this injury. So again, the hip flexor strain, just like any other muscle strain, can be a traumatic onset or can have a non-traumatic onset. Another contributing factor for a hip flexor strain is something I've spoken about in several injuries, and that is weakness in the core. Now, the core muscles are not just your rectus abdominis muscles, but they include the pelvic floor muscles, the medial thigh muscles, the gluteal muscles, the obliques, the transverse abdominis muscles, the diaphragm, and the rectus abdominis. So there's a lot involved. But weakness in the gluteal muscles, which are part of the core, can contribute to the hip flexor strain. Now, when we speak about overtraining, I talked about the three factors that lead to a non-traumatic injury, basically your overtraining injury, where you're doing too much training. Most people will be, especially beginners, will be doing too much too soon, or they will, when someone is starting back in training, they're definitely doing too much too soon. Not getting adequate rest between your training sessions, and a biomechanical fault. When someone is overtraining, there's several things that you have to realize. Usually signs of overtraining are just general malaise. You're tired all the time. You don't feel like you're recovering from your workouts. Your muscles are sore for an extended period of time. We've all trained before, we've all run before, we've all lifted weights, and we know how muscles feel when they're sore. And it can be pretty intense for a few days, but it shouldn't last so long. And that's what happens when you have an injury or when you are overtraining, is we're just not recovering from our workouts. So that soreness in the muscles just continues for way too long. And then also muscle fatigue. Muscle fatigue is a sign of overtraining, meaning that we're not giving our bodies adequate rest between our training sessions. We're working the muscles too hard, so the muscles are tired. They start to fatigue quicker than they used to. So those are some general rules for overtraining. If a hip flexor strain should occur, take action immediately. Do not hesitate. Let me say that again. If a hip flexor strain should occur, take action immediately. Do not hesitate. It does not matter if it is a traumatic or non-traumatic injury. Begin your self-treatment immediately. If you feel that you need to see the doctor, if this pain is intense, if it's not going away, get a professional evaluation. A hip flexor strain is an injury, like I said, that can have symptoms in multiple areas. It is very tough to self-diagnose, so please do not try to self-diagnose yourself. Get a professional evaluation. The doctor will help you an extreme amount. As a doctor of chiropractic, I have seen hip flexor strains in my office. What you want to do is make sure that you get the proper diagnosis, because that will help you to formulate your plan of attack so you can recover from this injury. You will get nutritional plan. You will get the proper rehabilitation plan that will help you recover from this injury and get back to whatever activity that you want to get back to. As a doctor of chiropractic, the main treatment tool that I utilize is called the chiropractic adjustment. The chiropractic adjustment helps to restore proper skeletal motion, which helps to optimize nerve flow. When I have someone who has a hip flexor strain, I am going to concentrate on the lumbar spine, which is the low back, the pelvis, the hips, and the lower extremity. I'm going to look at the entire kinetic chain and adjust whatever areas in that kinetic chain need to be adjusted. I will restore that proper motion. That's going to help to optimize the nerve flow, and it's going to put the body in a proper position so that it can heal properly. Now, when we speak about a hip flexor strain, there's several things that you want to do at home to help yourself to recover from this injury. Some very basic things that some people overlook. First of all, ladies, stay away from the high heels. When you wear a raised heel, that increases the amount of pressure that is forced onto the hip flexors. When you're wearing high heels, obviously the entire biomechanics of the lower extremity and the pelvis and the lumbar spine change. It puts an increased demand on the hip flexors. So if you want to prevent this injury and you want to recover from this injury, you need to stay away from the high heels. Also, for the men and for the ladies now, when we think about sleeping positions, I had mentioned sleep before. When we're laying down, if there's a hip flexor strain, there can be pain in the low back, in the pelvis, and in the hips, and in the thigh because of the origin in the insertion of the psoas major and where the iliacus originates from. We went over the anatomy before. When you are laying down, there's a couple things that you can do to help yourself to relieve the pressure that's on the hip flexor muscles. First of all, if you're laying face up, which is a great sleeping position, put a pillow or a wedge underneath your knees. That is going to put the hips into slight hip flexion, but it's a passive motion. You're not holding it there. The pillow or the wedge is holding you in that position. So it's going to put the hip flexors in a non-stretched position. When you're laying on your side, what you want to do is have the hips flexed a little bit, the knees flexed, and put a small pillow in between the knees. This is going to help take pressure off the hip flexor muscles. When we speak of prevention of any type of sports injury, and I say this on almost every one of Dr. Ozello's sports medicine reports, and you're probably tired of hearing about it, but I'm going to keep preaching this because it's so important. Prevention is easier, faster, and less expensive than injury rehabilitation. So do everything you can to prevent a sports injury. With the hip flexors, you want to make sure that you do not have a strength imbalance, that you are not quad dominant. So you want to strengthen the gluteal muscles and strengthen the hamstring muscles. stretch and increase the flexibility in the hip flexors and in the quadricep muscles. You can stretch the muscles, you can foam roll the muscles. That will help a great deal to eliminate the strength imbalance. Also, strengthening your core. I mention this all the time. You want to make sure that the entire core is strong. The rectus abdominis, the obliques, the transverse abdominis, the inner thighs, the gluteal muscles, the pelvic floor muscles, all of it is extremely important to be strong to help to prevent hip flexor strains. When we speak of self-treatment for a hip flexor strain, there's several things that you can do that will really help yourself out. First of all, you're going to need to modify your training, especially if it was a traumatic injury. You're going to have to modify your training a great deal. If it is a non-traumatic or that overuse injury, you're still going to have to modify your training. All you're going to do, well, I should say all you're going to do, the first thing you need to do is add more rest days and add more variety to your training, because this will help you a great deal. If you add variety to your training, you're going to be targeting the muscles and the joints and the bones from different angles all the time. If you're doing the same exercise over and over and over again, that leads to strength imbalances, and it also leads to overuse in certain muscles that are used more in that activity. So you want to add variety to your training. You want to add rest days. Now, when I speak about rest days, there's two types of rest days. There is your passive recovery day, where you're really doing nothing. You're just taking it easy, you're eating well, and you're making sure that you're letting your body recover. This will help you a great deal. Like when I spoke about before, the general malaise is a symptom of overtraining. So this will help you a great deal to recover from that. But more important is your active recovery days, because you're going to have, the reason I say more important, because you're going to have many more active recovery days than you will passive recovery days. In active recovery days, you do your stretching, your foam rolling, you get your chiropractic care, you get your massage, your professional stretching if you get that done, your reflexology. All of those things that you can do to help yourself to recover from your training, you do on your active recovery day. When we talk about self-treatment of a hip flexor strain, you're going to have to do some stretching of your hip flexor muscles and your quadriceps. You don't want to overstretch. You want to hold a mild, comfortable stretch, but you want to stretch those muscles from a variety of angles. You can do hip flexor stretches standing. You can do them laying on your side. You could do them kneeling. So you can really attack these muscles and stretch them from a variety of body positions. And it's going to help you a great deal. Also, stretch the quadricep muscles. If you can, strengthen the hamstrings, strengthen the gluteal muscles, do some core training. Just modify your training so that you're not putting additional stress on the injured hip flexor muscle. Work around that injury. Never perform an exercise that elicits your symptoms or makes your current symptoms worse. Work through a pain-free range of motion, and it's going to help you a great deal. Just like any other muscle strain, this is a very frustrating injury. It can occur out of nowhere. It doesn't matter if it's a traumatic or the non-traumatic injury, but it's also an injury that you can recover from. But you have to be very smart about your training, and you have to be consistent. Again, train hard, but train smart. Strengthen your core when you are recovering from the hip flexor strain. There's a lot of core muscles, a wide variety of core training exercises that you can do. Again, any exercise that you do, you want to make sure it does not increase your symptoms or elicit symptoms. So you have to work around your injury. And you may have to modify some exercises, but there's a large number of core training exercises that will help you a great deal. So I'm sure that you can find ones that are going to help you to strengthen your core and not to aggravate your hip flexors. In conclusion, first of all, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. The hip flexor strain is an injury that is preventable. And like I stated, it is an injury that you can recover from. The originates injury can be traumatic or non-traumatic. One more thing that I wanted to point out is make sure that you do a thorough warm-up and a comprehensive cool down before and after your training. So before your training, prepare your body for your workout, because the warm-up is going to get your body prepared. It is going from that non-exertion state to an exertion state. Your body needs to prepare for that. That's going to help to prevent an injury. The cool down phase is a great time to do your slow static stretching, which is going to help to increase flexibility and decrease muscle tension. The hip flexor strain is a chapter in my book. Again, my book is named Running, Maximize Performance and Minimize Injuries. Hip flexor strain is chapter 7, page 43. You can get the book to get additional information on the hip flexor strain. Always remember, sports injuries are something that we're all going to suffer. We want to do the best that we can to prevent these injuries and the best that we can to recover from these injuries. Educate yourself and use those tools to prevent sports injuries and to rehabilitate sports injuries properly and completely. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to leave questions, suggestions, or feedback in the comments section below. Please feel free to like this video. Also, please subscribe to my YouTube page. This will guarantee that you will get you will be able to view the weekly posts that I do. Every Thursday is Dr. Ozello's Sports Medicine Report. Every Monday and every Friday is when I publish my 2 minutes of anatomy classes. So you will be able to see all those if you subscribe to my YouTube page. Again, thank you for viewing Dr. Ozello's Sports Medicine Report, and always remember to train hard, train smart, stay injury-free, and accomplish your goals. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada.